Good morning. My name is Christian. I'm going to be your nurse today. Is that okay with you?
Yeah.
Alright, I'm going to go wash my hands and I'll be right back.
All right.
Okay, can you just verify your name and date of birth for me, please?
My name is Zachary Damali, born 11/16/1992.
Okay, cool. Hi, how are you?
Hi,
How are you in relation to...
I'm Brian. I'm Zach's cousin.
Cool. Is it okay if Brian's here
Yes,
with us right now? Okay. So I understand you have testicular cancer, is that correct?
Yes.
I'm really sorry to hear about that. How are you dealing with that?
I'm feeling a little depressed, but I'm ready to learn about any treatment you're willing to give me.
Okay, cool. So you're going to be getting Bleomycin today. It's a cancer medication. It's going to interfere with the growth and spread of your cancer cells in your body. It inhibits RNA and DNA synthesis, which pretty much stops the cells from growing in your body, okay? So your body has natural enzymes that break down this drug and pretty much render its therapeutic ability. The only places where your body doesn't have this enzyme is in your lungs and in your skin. So you may experience more symptoms in these areas as opposed to other parts of your body. Some of the general side effects of taking this medication are alopecia, which is hair loss. You may want to wear a hat or a wig.
Yeah, I'll just shave it off.
Okay, that's cool too. Toughening or hardening of your nails, hyperpigmentation of your skin, nausea and vomiting, and weight loss and loss of appetite. If this occurs, you may want to eat smaller, more frequent meals. Some of the more serious side effects that you may want to notify your healthcare provider about are shortness of breath, wheezing as well, black tarry stools, unusual bleeding, fever and chills. Your doctor may prescribe for you certain medications for the fever. If you're feeling chills, maybe just dress warmly. Mouth sores is another serious reaction. If this occurs, maybe you want to just, when you're brushing your teeth, do it gently. Do not use hot water and use alcoholic mouthwash.
So can I use Listerine?
Yeah, Listerine is fine. That'll work.
What can Zach do if he has nausea?
If you get nausea, the doctor may prescribe for you certain antiemetics which will counteract nausea and vomiting so that you don't have these reactions.
He's been feeling real depressed lately. He hasn't been talking. He's not been eating. Will he be cured?
Well, this drug is not necessarily going to cure his cancer, but this drug is given for palliative care as a comfort measure. So let me tell you about how we're going to be administering this medication. We're going to give it to you via injection. You're going to want to come back to here twice a week, and we're going to need to supervise you for up to an hour after we give you this medication to check for any serious adverse reactions that may occur. So Zach, do you understand everything that I've told you so far right now?
Yes, I do understand.
Cool, good. Do you guys have any further questions?
Yes, I have a couple of questions. You mentioned one of the adverse effects is shortness of breath. I have a habit of smoking and drinking, so how's that going to affect me?
Well, smoking is definitely going to increase your chances of lung toxicity, so strongly advise against smoking. And we want to preserve your liver functions because you're going to be taking a lot of medications right now, and your liver is what breaks that down. So let's not drink alcohol. Let's limit that amount of alcohol that we drink, okay?
Okay.
Just want to know, can he go out in the sun?
I would limit sun exposure, but if you are going to go out in the sun, wear protective clothing and wear SPF 15 sunblock or something stronger than that.
Okay. I like to scuba dive on the weekends as a stress reliever. Can I still do that under treatment?
Taking Bleomycin is going to increase your sensitivity to oxygen toxicity. So if you're receiving any supplemental oxygen, you're going to be at a greater risk for lung toxicity. So I'd strongly advise you to not go scuba diving while you're on this medication.
Okay. And while I'm on this medication as well, does this affect my sex life in any way?
Well, you can still have sex. There shouldn't be a problem with that. But there's a chance that you could pass off some of this drug in your semen. So let's use contraceptives. condoms during sexual intercourse.
What can Zach do if he feels nausea?
Well, the doctor may prescribe certain antiemetics which will counteract nausea and vomiting that may occur. Okay, I'm going to pull up your charts now.
Okay.
Liver and kidney functions look okay. Your lab values are normal. Let's have the respiratory therapist come in and talk to you a little bit more about this medication.
Okay, sounds good.
Okay.
So, good morning. My name is Pharm and I'm your respiratory therapist. Could I just get your full name and date of birth?
Zachary Damali, 11/16/1992.
Okay, so you're taking bleomycin, is that correct?
Yes.
Okay, well the drug can reach its toxic levels in the lungs, which can lead to pulmonary fibrosis. And that's a scarring in the lung, which can reduce the amount of air that you breathe in. And so I just want to take some lung baseline of your lung assessment so that if there's any changes, we can discontinue the drug and look for an alternative. So I'm going to start off by listening to your lung sounds, and then I'll give you a device which will measure your total lung capacity, how much you can breathe in and out. So if there's any changes in that, we'll just discontinue the drug. And some of the symptoms you want to watch out for is difficulty breathing, shortness of breath, any wheezing. Any of those you definitely want to notify your healthcare provider. And having those symptoms can be very frightening, and the last thing we want is for you to hyperventilate. So to help reduce anxiety, you might want to try some relaxation techniques, so such as meditation, deep breathing exercises, which we can go over later. I can send you home with an incentive barometer. I'll tell you about that later also. It's going to help you control deep breathing, and it's going to help expand your lung, which will be very beneficial to you. And I'm going to have you come in for a chest x-ray 1 to 2 weeks, so we can see if there's going to be any changes. We'll know before it gets out of hand. So do you have any other questions?
No, I'm good.
No? Okay.
No.
So I'm just going to start off and listen to your lung sounds and temperature. Okay, so your lung sounds are clear, your temperature is within normal limits, and you should be good to go.
All right.
Okay, Zach, so we're going to administer your medication now, okay?
Okay.
Alright. Can you just confirm your name and date of birth for me one time?
Zachary Damali, 11/16/1992.
Okay, good. Alright, you're going to get your bleomycin now. Okay, so let's just make sure you're doing that medication. Bleomycin. Okay, getting bleomycin, Zach. Hold your pressure here. Okay, Zach, it's been 30 minutes since you've received your medication. How are you feeling?
Feeling good.
Good, good. So I'm just going to check your lung sounds and your temperature to make sure that you're not having any adverse reactions, okay? Okay, Zach, everything seems to be fine. You don't have the temperature, your lung sounds are normal. That's it for today. Let's go schedule your next appointment.
All right.